I think when you think of swing bed integration, you think about quality care at home. And when we have patients that are coming from all over our service areas, to be able to come back for the post-acute care services they need within their own community hospital setting, it increases quality, it increases access, but more importantly, it increases patient outcomes because your providers know you. You're receiving care at your local hospital, and that's what's the difference between us and other skilled nursing facilities and swing bed facilities across the area. I look at it as a holistic aspect. It's how do we here at Central Maine Healthcare provide care for the full continuum. So a lot of times we refer to the care received here at Central Maine Healthcare or Central Maine Medical Center, but we're really talking about the care that's evolved throughout our system. So these folks will transition from here, our main hospital campuses, to Bridgton and Rumford to really get that specialized level of care and service and therapy that they can't get here at our local hospital.
So there's a number of patients that can benefit from the swing bed program. So patients who may have had a knee replacement or a hip replacement, who have their only 3 or 4 acute nights in the hospital, would be otherwise discharged to home, but may need a few extra days of help with nursing or physical therapy to get their strength up again so that they have a successful transition to home and not need to come back into the hospital. Communication amongst the team is always key to the success of our patients. So the team works every day and discusses each and every swing bed patient and how the transition is going, what therapies they need, what additional therapies they may need to again ensure that they are successful, they're gaining the strength, they're meeting their milestones and their goals so that they can get home successfully.
People don't know what a swing bed program is, and the fact that you can recover at a swing bed program in a lot of the same ways that you can recover at a skilled nursing facility, but you get something that's unique. You get more nurses for the same number of patients. You get individualized care from the therapists. You get a 24/7 presence of a physician or a PA or a nurse practitioner to help to take care of you when a medical need arises. And at a swing bed program, you get a little more personal attention. We have a number of care managers who help both the transition into the hospital, but also to make your transition home as smooth as possible. And because we are located within your community, we know most of your primary care providers as well. A lot of times we actually have access to their records directly within our system, so we get to know you a little bit better than if you went to a skilled nursing facility.
There's a little cliche about everyone knowing your name, and that's exactly what it is at those settings in Bridgton and Rumford. Is you just aren't a patient, you're just not a number, you're someone with a name, with a family that's there to support you for the long haul. And those community hospital settings with their swing bed programs just do that. And I think that's probably why we're able to achieve the optimal outcomes that we can in those settings, because you're more than just a patient, you're part of our Central Maine Healthcare family.